Welcome to the individuals who just joined our session. Thank you very much. We are just in the process of inviting and allowing everybody to come into the session. So you see the title screen, and we're just going to give it a few more minutes to allow some more people to join, and we'll get started. I'm just going to give it another minute to allow a few more people to join, and then we'll go ahead and start. Thank you. Okay, let's go ahead and start our session. Welcome. I'm Laura Pinger-Kyle, the Director of Specialized Services. I want to thank you for taking some time out of your Wednesday evening. Much appreciated. The supervisor team from Specialized Services is also on the call with me, and we look forward to updating you on information regarding back to school and returning to learn. I'm going to start out with some general information. If you've participated in any of the other sessions, you've heard a little bit of this, and I just wanted to make sure to frame it through the lens of special education. Our decision-making process in the district, we have not taken lightly. We have been working very hard and using much data to inform our decisions in terms of educational models. And this graphic shows the three different entities that we have been using. The first and very important aspect is stakeholder feedback. We have read every single comment from families. We've also we've engaged families in other input sessions, and then also such as this evening and providing some more information. In addition to formal listening sessions and surveys, I know I've spoken to many families on the phone, and I know our supervisors have also in responding to emails. And so we are here to help and support you in decision making or answering questions. And so please feel free to reach out to us via either phone call or email, and we want to make sure that you have the information needed. And then state guidance, we have been in constant collaboration with Minnesota Department of Education and Minnesota Department of Health in terms of what the requirements are and the guidelines. We also are fortunate to have close working relationships with a variety of school districts in Minnesota, and our supervisor team as well as myself have been on multiple meetings with other administrators in special education, and we've been able to do a lot of discussion and planning. And so it's nice that we're not in this together in Eastern Carver County Schools, and we are working in collaboration with many entities to best be prepared to serve our students. And lastly, we also have been utilizing public health data Carver County Public Health has been a wonderful partner to our district, and we have actually our own Tara Cliff, who is our health services supervisor, who's also on the call this evening. And she is an important person in our department and our district, and is incredibly knowledgeable regarding COVID and all the precautions that we need to be taking in our district. And so we welcome any questions that she can help out with as well today. This graphic shows the current data and basically where we're starting. So if you think of this as terms of a scale, this is where we were. The last time we utilized the data that was public, we were at 17.2 cases per 10,000 people in Carver County. And so that tells us that we can be in a modified hybrid for secondary and elementary in person. And so what we are doing and starting out the school year is grades K through 5 in person, all students, Monday, Tuesday, Thursday, Friday. Grades 6 and 8, middle school, is in a hybrid model, 2 days a week, and distance learning for 3. And we're starting with a distance learning for all for high school. Now, our superintendent, Sales Adams, has committed and publicly said that our goal is we will be in a hybrid model for high school on or before October 8th. We just left Chaska High School. The supervisors and I were there this afternoon planning with all the principals. Actually spent all day Saturday with them as well. And everybody's just working really hard to get things in place at all buildings, but especially the high school, so that we can welcome students into the building as planned within just a few weeks after the school year starts. Before I talk about this slide, which is just a general introduction to special education, I just wanted to say from here through the end of the presentation, everything is very specific to specialized education services, to students receiving services on an IEP, which will be different than what you've heard, or in addition to what you've heard in other sessions. I also encourage you, if you have questions, to enter those into the chat. And Neva Crocker is also monitoring the chat for us, and will be getting us the questions as we go along. So as soon as we get through the slides and providing you with information that we've prepared for you this evening, I will facilitate a Q&A, and I will be asking our supervisor team to help me in terms of answering the questions for you. We have had a few questions submitted ahead of time, but I again encourage you to enter questions, and we will do our best to get through them within the time that we have until 7:30. So specialized education services, so FAPE. I'm sure you've heard that before, and what that stands for is free, appropriate public education. And so regardless of the educational model that we are in or could be in during the year, we will be offering and providing that FAPE within any of the educational models. And what that means is that we are dedicated to providing equal access to education to our students on IEPs in the same manner as their non-disabled peers. Now, I just want to throw some caution out there that in some of the models, actually all the models at this time, education looks different for all kids. And so our job in special education is to ensure that our students on IEPs receive equal access to the education as their non-disabled peers are receiving, which again, looks different now than it maybe did last year, and hopefully not for long. But our main goal is related to the safety, health, and welfare of our students and members in the community, which is just critically important to us. And again, earlier I had stated that we have been in collaboration with local, state, and then also wanted to mention in federal partnership with leaders. We participated in more Zoom trainings and Google Meet sessions than I'd like to admit to. A lot of training and collaboration for us as well. And I just really want to acknowledge and take this opportunity to thank you as parents for your partnership and for supporting our districts and our leaders and our teachers during this time. The reality is that we're in a pandemic, and one in which we don't know and we've never been, and it's brand new to all of us. And so we are truly recreating and creating the educational system in ways in which to provide services to students with disabilities and services to students without disabilities in a variety of different educational models. And so this is something that we have not been trained for. We have not experienced, obviously, any of us. It's not anything that we can open up the manual and read, how to do this. And so going back to that collaboration and partnership has been vital. And we have benefited greatly from the partnerships in our state and federal level. I also acknowledge in the spring, while we were forced into a distance learning model, that was a difficult period of time, and we were planning and recreating that system under a crisis. We had just a few days to put things together and continue to evaluate, monitor, and adjust. Now, going into this fall, we have learned a lot. We've received a lot of input. We've asked a lot of questions, and things will look different than they did in the spring. And so one of the things that I want to make sure that you hear is that we, as a special education administrative department and teachers, have extremely high expectations for our students and for their learning. We also have been working in partnership with our principals to ensure that the core instruction for all students, there are different expectations for students moving into the fall than there were in the spring. And so I know Kelly Crick-Oburn is going to talk a little bit more about that in just a few moments. But at this point, I'm going to turn it over to one of our supervisors, Michelle Chuka, who will talk about the individual education plans and contingency learning plans. So this is what's famous as the due process, the paperwork. So it's very important that you understand the commitment we have to IEP team discussion and development and making sure that our plans are effective for students. So Michelle.
Thank you, Laura. So you will recall last year we created what was called an Individualized Distance Learning Plan, or IDLP, for each student in March that laid out how their IEP services would be delivered in a distance learning model. This year, we're mandated to create something called a Contingency Learning Plan, or CLP, for each student who has an IEP, to lay out how IEP services will be provided in all three models: in person, in hybrid, and in distance learning. By doing this, we will allow for a smooth transition between all three models, as we anticipate that movement between models this year will happen regularly. As parents, you will be an important part of this process, and your student's IEP manager will be reaching out to you upon their return to work, which is they return the week of August 31st, and they will be setting up an IEP team meeting to amend the IEP and add a contingency learning plan for all three educational models. I'm going to hand it over now to my colleague, Kelly Crick-Oburn.
Good evening, everybody. Thanks for being here. I'm really excited to tell you about our instructional expectations, and I have to tell you, our staff that have already participated in some training around these expectations are also excited. So first of all, I want you to know that we heard your feedback in the spring loud and clear. Our teachers used a variety of platforms to support learning during distance learning, and that was a challenge both for students and for families. And so a really important component of Distance Learning 2.0 this fall will be a common platform, which will be Google Classroom, and we'll be using Google Meet to support distance learning. Some of the features of this this platform that are really important to note is using this consistent platform will allow families to be able to navigate, families and students, to be able to navigate a very common template for their classes. Each teacher will have a Google Classroom. Each Google Classroom will use a common template, so it will be much easier for your students and for you to navigate that classroom because it will be very consistently structured. Some new features this year in Google Classroom that will be helpful to you as a family and to your student is a day, a week, or a unit at a glance, and that will be a common expectation for all teachers that you be able to see at a glance what your students are working on. There's also a new Guardian summary, which will allow teachers and administrators to invite guardians to receive email summaries about students' work. You'll be able to be aware of missing work, upcoming work, announcements. So watch for that opportunity to receive Guardian summaries, which are confidential and would only go to guardians. In addition, and part of our movement to Distance Learning 2.0, our staff will be receiving training on how to leverage Google Classroom, Google Meet, and other aspects of the platform to engage students in meaningful, high-quality instruction. Professional development will also be specific to specialized educational services with a focus on high-leverage practices in special education. So your learners will engage in both synchronous and asynchronous lessons. So let me just define those terms for you, and they'll become part of your vernacular soon if they're not already. So synchronous means in real time. So a lesson conducted remotely, just like this. You're online, your student's online, the teacher's online, and they're in real time. Asynchronous means at a different time. So a teacher will prepare lessons ahead of time, students will participate in those lessons on their own, and then there will be a feedback loop after that. So you can expect both types of lessons that will, in specialized services, be very targeted and specific to IEP goals and objectives. We will prioritize our in-person time with students on priority learning targets that would be more challenging to support in a distance model. We will prioritize social emotional learning. We know now more than ever we need to support the social emotional and mental health of our students, and so that will be a priority component of our face-to-face instruction. In addition, we'll be prioritizing progress monitoring during face-to-face to ensure that students are making continuous progress on those IEP goals and objectives. Finally, engagement in distance learning and teleservices will be supported with a strong parent-school partnership. Leveraging our partnerships with you has always been a critical component of the provision of specialized services, but now more than ever, we are going to work very hard to partner with you to find ways to support your student and your family to meaningfully engage during those distance learning lessons to ensure students are having success and engaging and making progress on those goals and objectives. Let's see, and then in addition to our high quality licensed educational team, we also have, as you well know likely, an exceptional paraprofessional team. Our building special ed programs do have paraprofessional support. Many of you know your students' paraprofessionals. They played a critical part last spring in helping students be connected and engaged and in their relationships with students. So we will continue to leverage that important resource in partnership with you to support students to move toward their IEP goals and objectives. The next thing I'm going to talk with you about are evaluations, and I want to start with a celebration. This summer, we held our first summer evaluation clinic. This was an opportunity for us to bring in some students and families to work on some of the evaluation components that were paused in the spring due to COVID-19. So we were able to work with 30 plus students this summer to make progress on those evaluations that were paused. And that will help our teams in the fall as they come back to school be more efficient in wrapping those evaluations up in order to determine eligibility or continued need in a more timely fashion. Our summer evaluation clinic also gave us an opportunity to prepare our building for a safe return, to bring staff back into a building and get their feedback about that safe return, trialing our PPE, making sure that we were learning as a staff how to have a safe environment. We received valuable feedback from the staff that participated in that clinic, feedback from parents, and we learned a lot from that process, and I'm really thrilled to say it was a safe return to school this summer for the students and families that participated. Evaluations that were put on hold last spring due to COVID-19 will be completed as soon as possible when staff return. And like Michelle said, staff return on the 31st. You can expect a phone call from your IEP manager or from a clerical in that team to schedule meetings. If you have an evaluation or a reevaluation that was paused, those meetings and that work will be prioritized so that we can complete those as quickly as possible. Something that will help with the efficiency of our evaluation process is a new suite of online evaluation tools that we're looking forward to rolling out. IEPs will continue to conduct initial and reevaluations as we always have under the same timelines. As some of those procedures will be face-to-face and some of them will be through distance learning. And again, we'll partner with you to determine how to best support your student to engage in the evaluation and reevaluation process. And of course, as always, you will remain a critical member of that team and part of that process. Thank you. I'm going to pass it now to my colleague, Jenny Davey.
Hello all. I'm first going to talk to you about the Eastern Carver County Schools Online Learning Academy, or ECOLA, and how that will relate to special education services for your student. So as Kelly was talking about before, Google Classroom will be the platform that we base our services from. So there will not be any difference in that. And then if students come or go from that throughout the school year, let's say they come back in January, they will have the same basic Google Classroom models to work from. So we hope that'll make it a little easier for students. Also, students may be assigned a new IEP manager and receive instruction from new teachers, but they might have their same team from their building. So know that we have been working diligently as the numbers for ECOLA have come in. There was changes even as of early this morning to make sure that we are staffing it so that those students have the services they need. So you should be finding out quite soon when teachers come back who the IEP manager is for your student, so you can get more information that way. But it's definitely people who we've had in our school district, and we've been very thoughtful about how those assignments are happening. Also, as Michelle Chuka talked about before, the specifics about what the ECOLA distance learning format will look like will be included in that contingency learning plan, or CLP. So you will be part of that team that talks about what your student will need in that format. So maybe in school, they needed something, but they might need something else at home that you might have learned about last spring. So your team will talk about that and really lay out clearly what that will look like for your child. In ECOLA, all special education services will occur virtually or in other distance formats. So there is no in-person service in ECOLA. All students at all levels have access to Google Meets. And I bring that up because I know last spring at our elementary level, not all students had that access right away. So we're starting the school year with that access so that that interaction is able to take place in a way that's easier for students and for families. The only thing that might happen in person if your student is in ECOLA is if they are in an evaluation, like Kelly was talking about, there sometimes is face-to-face assessment that is necessary. for example, an achievement test. And then we might have to talk about bringing in the student. But other than that, everything would be happening in a distance format. Next, I will be talking about behavioral and mental health services. So all of our students in our district have access to counselors and social workers, and that does not differ for our ECOLA students either. We know that relationships are the foundation for strong behavioral skills and mental health, and that's even more important when we've been going through a crisis as a community. So we are learning ways to build better relationships, both in person and virtually. We know our teachers are pretty good at building relationships in person, but that virtual piece is taking some extra learning just to make sure that our students feel seen, heard, and cared about, even when they're sitting at home across a computer screen. Also, our district has worked with our community partners to deliver co-located therapy services in all buildings. So that is a general education service, but I mention it because many of our special education students do take advantage of this service in their buildings. So it is not something that you would see as a service line on their IEP, but it is something that students who have mental health needs can access. Also, behavioral and mental health services may be delivered primarily through teleservices to prevent intermixing between buildings. So many of our behavioral and mental health services are teachers who have multiple buildings that they service. And instead of going to 3 buildings in one school day, we're asking them to try to be in one building in a day. And if there are needs in other buildings, which, you know, mental health services and behavioral needs, you can't always schedule. We really want to make sure that that teleservice is available so that students can have those contacts with those supports as they need those. And so I'm going to turn it over to my colleague, Michelle Bedore.
Hello, everyone. I'm Michelle Bedore, and I'm going to talk a little bit first about related services, and then I'm going to talk about early childhood. So our team of fantastic related service providers are going to be working in a lot of different methodologies. They're going to be doing in-person, and they're going to be doing teleservice and proxy service. So you've probably heard the term teleservice a number of times tonight. And really what that is, it's been used in rural Minnesota for quite some time, especially where distance is a problem and people can't get from one school to another because they're so far apart. So that's a service that has already been happening prior to COVID, and now we're taking advantage of it. So that is when we're tuning in via Google Meets from one building to another or from home to home and providing that services through the computer. And then proxy services is really about teaching our paraprofessionals and our teachers to do the services when they are when we are not in the building as a related service provider. So they can do the services and provide some of that intervention when they're working with a child. When we're not in the building, like I said, we will be coaching those paras and the teachers that are working with the students so that they can continue to promote those goals and objectives. Our IEP teams will work together to determine what the services are that your child needs and what's the right fit for them. And then on those at-home days, like Wednesdays, they will be providing activities so you can help your children stay on track. Next, I'm going to talk about early childhood services. So in our early childhood family learning center and students that are at Victoria Elementary in our half-day program, it's going to look a little bit different this year than it has in years past. So our preschool program will be up and running on a 5-day cycle, different than the elementary schools. So if children were signed up for a Monday, Wednesday, Friday class, they'll still come Monday, Wednesday, Friday. Or if they're signed up for 4 days or AM or PM, they'll still come in the same schedule that they were signed up for. Parents will drop off at the exterior door that goes from the playground into the teacher's classroom. So parents won't be entering the building and coming on through. We will attempt to do social distancing the best that we can. with little people, that can be a little bit more challenging. But we have lowered our class sizes, and we have put kids together in what we call pods of small groups of kids, so that they don't cross over with other groups. Our building will be cleaned every night, and our high-touch areas will be cleaned throughout the day. And then our staff will have cleaning kits that they will use in their classroom to clean materials between uses. So a small group of kids might come and play with something, it'll get cleaned and set aside and wait for the next group. In a hybrid model, our model will look very similar. So whatever services and whatever classroom your child was signed up in, that will not change in hybrid. Distance learning, however, is something that parents need to opt into, just like the Eastern Carver County Schools online for K-12. We would want you to let us know, either myself or Becky Carpenter, that you're opting in to distance learning for your early childhood special ed students. And I am going to toss it to Michelle Chuka.
Thank you, Michelle. All right, so the STAR program is our 18 to 21-year-old transition program, and that is going to open in a hybrid model. The district will be splitting all students into A and B groups across the district, as Laura described earlier in this presentation for hybrid. The A students will attend Mondays and Tuesdays, and the B students will attend Thursdays and Fridays, with Wednesday being a remote learning day for the entire program. Rest assured, we will dedicate some teaching time up front for our students in STAR for teaching and modeling expectations for social distancing and mask wearing, and we will be diligently working to clean high-touch areas throughout the day. One big change that I do want to note for STAR this year will be how we work on work readiness skills and community participation skills. At STAR, it is our tradition that we spend a lot of time out in the community at different job placement sites and exploring the community for what it has to offer. This year, just for safety, we're going to have to work on those skills in program by embedding what we can in the day-to-day operations of STAR and other simulated experiences. If you have any questions about STAR specifically, you can feel free to reach out to me directly anytime. So I will toss it back to Laura now, where I think we will start a question and answer session.
Thank you, supervisors, for providing all that great information. We do have a number of questions, and so we have about a half an hour left, which is great. We'll be able to address many of these, if not all, so far. So keep the questions coming in if you have other things on your mind. I'm going to start out with a few questions regarding mask wearing. There have been a lot of questions and wonders about what that's going to look like. And so Tara Cliff, if you want to come on while I'm starting, I'll start us off a little bit, and then I'll ask you to join me in on some of the answers. One person asked, will students need to wear their mask all day in the classroom? And that's a great question. We have an executive order from our governor in a mandate that all individuals, all school-aged children need to wear masks in school. And so we are actually working on a school board policy that's also a requirement now for all school districts and charter schools to have in place. Our school board had their first look at a drafted policy just this past Monday evening. And we are actually currently working on modifying and just tweaking that. They will be taking a look at it again in the next few weeks. Our goal is to have that approved and actually enforced on day one of school. And so to answer the question, will students need to wear them all day in the classroom? The answer is yes. Wearing the mask is important and it will be required. Now there are some exceptions or some things that we can modify to that. There will be, if a student is not able to wear it, there will be an exemption that's articulated in the board policy that will work with families We will be asking a family to have a physician or a doctor's note regarding that. And for students who are on IEPs, that is something that the IEP team will discuss and create a plan to ensure that the student and all those around the student are safe. And another question is in regards to how are teachers going to help little kids keep that on? And you know, that's a great question. And our teachers, our elementary teachers and elementary principals have been working on that already. They're working on mask campaigns. Our teachers are working on social stories to help teach. And we're really coming from a standpoint of this is a skill that we need to teach just like anything else. So we expect that we're going to have some struggles, but we also expect that the students will learn different ways. And so I know Tara has talked a lot about a variety of different masks and choices that we can do. And so I'm actually going to ask her to come on and talk a little bit more about that. And Tara, another question we have in regards to masks is, are face shields an acceptable alternative to those who just don't tolerate masks? So Tara.
Yeah, they're all great questions. We are going to try as much as possible to build in some mask breaks for students during the day. So we understand that wearing a mask for 6-7 hours a day is a lot. And so we're trying to build in some times where we can have students take a mask break. That will definitely be social distanced, outside if possible, and working on what that looks like. So we're going to try to do that. If your student is having a tough time with masks, I encourage you to try different types. I know we had some in our house that an aunt had made for us, and God love her that she was, doing something great for us, but they really were uncomfortable and hard to breathe in. And so it took a little time to try to find one that was comfortable for us, that we felt that we weren't suffocating in. And so I encourage you, not to give up with your first try, but to, look at a couple different options. I know that there's some cones that you can put in the mask itself that I've heard that people have had good luck with, and it isn't quite right on the face, that it helps students, especially with sensory needs, it pulls it away from the face a little bit. It still creates the tight fit around the face, so there's not a lot of air escaping, but yet it's keeping it off of kind of the nose and the mouth area. So that is an option that maybe you would like to look into as well. And our teachers are adept at, trying to work with kids and teach them the expectations. And as Laura said, they're working on social stories. And so we're going to do our best to try to work with kids and families so that they're able to wear a mask at school. The mask is the gold standard. That is what the Department of Health wants all of our students and staff to wear. However, there is a provision in the executive order from the governor that says if a student is unable to wear a mask, that, with our documentation pieces, because of a health or sensory issue, that a face shield would be acceptable as well. So gold standard is the mask, but if that's not working for our students, we could look at a face shield as an option. And I believe that was all your questions. Is that correct, Laura?
Yeah, would you want to just also talk about what our staff will be wearing and utilizing in the classroom?
Sure. So our staff are also to be wearing a mask, and then we do have face shields as well. They serve two different purposes. The mask is more of a source control. So it is if I'm wearing a mask, it is protecting you from me. And a face shield is different. It serves a different purpose. It's protecting me from everybody else. So they do serve different purposes. So that's why we're careful in how we're developing our procedures. let's see. So our staff are going to be wearing masks and face shields. The governor's order does provide some provision that they can take off their mask. Teachers can take off their mask part during instructional time, provided that they are 6 feet away from the students. And so, you know, we're going to do the very best we can. We know some of our deaf and hard of hearing teachers, our speech teachers, our center-based teachers, we have gotten a different mask that is called a humanity shield. And it's kind of like a shield and a mask kind of put together so that we know that it's really important for some of our students to see those facial features or to read lips. And so we have ordered some extra, a different type of face shield and mask for them as well.
Thank you, Tara, very much. My next question is going to be directed to Kelly Crick-Oburn. Kelly, if you want to come on in. We have a question regarding this parent has a son with an IEP that contains mostly social skill related goals. And just wondering, are we going to be offering social skill groups this year? And what may that look like?
We are absolutely going to be working on social skill development. And social skill groups is one way that we do that. So in a distance learning model, that may look a little bit different. It may look like students meeting in small groups via Google Meet. But we will continue to use a variety of strategies to support students' social emotional learning and their mental health. So absolutely, if social skill group was part of your students, oops, excuse me, I've got a 9-year-old here. Give me 1 minute, honey. No. Okay. Sorry, honey. Oh boy, this is what it's all about, right? We are all dealing with the same challenges. So thank you for your grace. So we were talking about social skills and social skill groups. So in distance learning, we may utilize Google Meet. And face-to-face, because of the social distancing and the concerns about supporting students' well-being and safety, that will also look different. It may look like students meeting, further apart in a socially distanced way, or being creative with one student meeting via distance with a Google Meet and another student meeting in person. So our staff will be doing a bit of trial and error, thinking about creatively about how to support students to learn with one another, because we know that peer interaction is a really critical part of social skill development. So that's a long answer and a little bit of disruption to that question. Thank you.
It's all good, Kelly. We're all in this together. So
that's absolutely right.
Thank you for your answer. Next question, I'm going to send it over to Michelle Chuka. So Michelle, if you want to come on. The question is, we have a few questions actually about the CLP that you described. And so one of the questions is just about timeline of that, knowing that there's a lot of students with IEPs in the district. Our average teacher caseload is anywhere from 14 to 18. And so when would a parent expect for those meetings to occur? And when could we expect those to be finalized?
Okay, so as Laura mentioned, we do have many students who have IEPs in the district. So as much as we would like to get those all done, those first few days of school, it will take us a couple of weeks or a few weeks to get through. With every case or every IEP manager needing to set up anywhere from 12 to 18 meetings, plus also be a part of some other meetings as well. But we will get those set up as soon as we possibly can. I know case managers are ready to give families a call when they get back the week of the 31st to get those meetings set up as soon as possible, with some possibly happening that teacher workshop week and many happening in just the days and weeks following that. But we would expect that the majority of these plans would be in place within a few weeks of school starting.
Thank you, Michelle. Hang on, because the next question is going to be yours also. So the next question is, so we have our different models of education that we're starting out with, and how they're different than what we experienced in the spring when the governor declared we are going distance learning. So there's a question, and we've also heard in the media that there's other school districts who have announced that they are potentially going hybrid or in person, and then all of a sudden already they're changing their mind and going all distance learning. So the real question is, if we go to distance learning, will our students still have an opportunity to come in for any services? Can you explain that for us?
I can. So the contingency learning plan is going to create a plan for students in every single model. So when you sit down as a team, you are going to create what a plan looks like if we have to be in distance learning, what the plan looks like in hybrid, and then any changes that might need to happen because of COVID in person. Now, if we are mandated into a distance learning due to our COVID community numbers, reaching a level where it's not safe for staff and students to be at school, then there will not be an option for any physically in-person services. All services at that point would be delivered through distance learning only. Now, where we're a little bit different right now is at our high school level. For the first few weeks of school, we're in a voluntary distance learning model, meaning that all students will have the opportunity to come in and get some time with their teachers should they need it, whether they're in general education or special education. So the staff will be in the buildings, and students, small groups of students can come in. So if you have a student at the secondary level and in those first few weeks of school need to come in, we can work with our teams when we create those contingency learning plans to see if they can come in. I just want to really make clear the line though. The only reason that we're able to bring students into the high school right now, even though it's in distance learning, is because we are being more restrictive than the state guidelines. If the state guidelines mandate us into distance learning, then coming in person would not be an option.
Thank you, Michelle. And you can stay online, and if any other supervisors want to come in to also support this. I know we have lots of questions about this, and it's also related to CLPs, but the question really is about, reference to the potential that students may receive in-person assistance at the high school level to begin with, or at the middle school level in a hybrid model, knowing that they would come in 2 days. There's also some conversation about there's a potential for students who could come in for more than 2 days. So can you just talk a little bit about that and how that, just reiterate how that process would occur?
Yeah, again, that process would occur during that contingency learning planning process that the IEP team will do. In a hybrid model, we are limited to the amount of people that can be in the building. It can't be above 50% capacity, and everybody has to maintain that strict 6 foot of social distancing. But that doesn't mean that there aren't some students that it might be appropriate for them to come in for additional days for special education services. So all of those things would be decided on a case-by-case basis. With a lot of thought around how much progress is the student making in the current model, what kind of progress did the student make last spring. So the IEP managers will have a lot of questions to pose to the IEP team to help facilitate that discussion so those decisions can be made individually.
Thank you, Michelle. Next question is similar. But it's about flexibility in the model. So for example, elementary students are coming in 4 days a week. And so a question would be, if I'm just not comfortable with my child being there a full day, do parents have the option of picking their child up early?
So as a parent, you have lots of options, right? To pick up your child. An IEP team decision though would be if those decisions would be made if the student's disability somehow prevents them from staying for a full day. But typically It's pretty rare that we would decide in an IEP that a student couldn't stay the whole day. But if you as a parent make some decisions to excuse your child from school for various reasons, that would be something that you could do. If it's a disability related reason, I would encourage you to bring that up to your child's IEP team so you all can make some informed decisions around the best way for school to look for your child in that model.
Thank you very much. If Kelly is available, if you want to hop back on, I just have a follow-up to the social skill question.
Sure.
And this actually came from one of our new families who moved into the district. So first of all, welcome. We're really glad you're with us and in our district. The question is that they moved last year and that her children have not made friends quite yet. And just wondering how our teachers will encourage students to build friendships throughout the day, given all of the variety of distance learning and educational models.
Yeah, that's a great question, and that will be a challenge that's very unique to this school year. Student, as I said many times tonight, social emotional learning is a critically important part of our curriculum and a part of the supports of specialized services. And so when students are face-to-face, we will be finding opportunities to support social emotional learning that at the same time create a safe environment. So there are many strategies and games that can be played within social distance. There are many types of technology that can be used to support social distance should that technology be developmentally appropriate for the student. And there are many different materials that might be used to support social emotional learning, curriculum materials, hands-on materials. So while I can't give you specifics that would be immediately relevant to your student because I don't know your child yet, but I'm looking forward to meeting him or her, do know that all of our staff recognize the critical importance of social emotional learning and will be employing every creative strategy and intervention they can to ensure that students have a chance to not only develop their own social skills, but develop that reciprocal piece that is necessary for us to be able to use our social skills. And that will include time interacting with peers to practice those skills in ways that are safe, both face-to-face and via distance model.
Thank you so much, Kelly. Tara, would you like to come on? I have a question I'd like to direct to you. And let me go ahead and read this to give out all of our families the context. Over the last few months, many hand sanitizers have been added to a list of toxic products that should be avoided. There are ingredients in these that can lead to death, which is obviously concerning as a parent and a director of special ed and a supervisor, of course, and specifically as a parent of a child with special education needs who may likely consume hand sanitizer. I'm aware that there's a heightened concern for hygiene at this time, but I'm hoping that the hand sanitizing and cleaning products used in the classroom is researched and found to be safe to use with young children. And so this parent is just asking about this and wondering if we can verify that the hand sanitizers that we're using in the school would be a safe product.
Yeah, that's a great question. We always promote hand washing with soap and water is our best option, but hand sanitizer is available when hand washing isn't available or convenient to do as often as we would like. For that, I know Jim Munsmeyer, our Buildings and Grounds Director, he is taking the lead on our hand sanitizing stations across the district, but I do know that his cleaning products that he has ordered are EPA approved. I know that other hand sanitizer pumps that we've ordered through the district are also, they're not on the list of that toxic recalled hand sanitizer. So, we definitely are keeping our eye on the products that we are using and I believe that, they're as safe as we can have them during the day. Again, hand washing is best with soap and water, and we will try to do that as much as we're able to. But just know that hand sanitizing is a backup when we don't have another option.
Thank you very much, Tara. Let's see. I'm going to go to some questions about the ECOLA, which is our online academy. So I know Jenny Davey presented some information. So if Jenny, you want to come on, be great.
Sure.
Thank you. Let's see. One question is regarding IEP management, and just a question about how are we determining that IEP management? I think we heard you say during that slide that it may not be the same IEP manager that would typically have been provided at that neighborhood home school. And so can you tell us a little bit more about how we are going about determining IEP management or even related service providers who will be supporting students in that online academy?
Absolutely. So it really is based on the numbers of how many students are going to be in ECOLA versus the school, and also if they're resource or center-based. So we have a few different things that we think of. Also speech is another category that we've been thinking of as sort of our base for choosing what students need and how they will get that. And then we've been comparing that to what's available first in their home building, because we had a preference of if it could be in their home building with a team they knew who knew them. We tried to do that when we could. There were some buildings who did not have the staff to do that. And so we were able to assign those students to another staff member who can focus on those students. And so we are still in the process of tweaking those things with more students coming into ECOLA and different things changing with staffing and students. But those are the things that we are thinking about when we are making those determinations. So for related service, we also have the question, okay, should that stay in their building, or does that go with whoever's going to be their case manager? So we had some good conversations about individual student needs regarding where those services would come from. And so we hope to finalize that in the near future so we can get that information out to you. But it's been a multiple day process in trying to figure out what's going to work best for our students.
Thank you very much, Jenny. There's a few questions also about the ECOLA and regarding, are we able to provide families with any more information on what time synchronous learning will be, what time will check-ins be, what will that schedule look like? And I guess I would just offer that I know we have principals who are working on that, and I just this afternoon saw a draft of a schedule. And so I don't think that we're at a point we can effectively answer that right now, but what I can say, it's going to be available very soon in that. There was a question about synchronous learning lessons and if those will be recorded in case a student occasionally misses or if they have issues with internet. And I guess that could be anywhere from our online academy to within our hybrid model or our high school distance learning model. Jenny, are you able to answer that?
Absolutely. I think right now we are still learning about that and trying to figure out what that looks like for students. One thing that we will not be doing is recording special education groups of students. So let's say we're having a Google Meet with multiple students, could be a social skills group or academics. We would not record their group because that identifies special education student names and faces to then share with other students. We would not be doing that. It is possible, depending on the situation and what teachers are doing, that they might record themselves so that they wouldn't be giving away any confidential information about our students. So we don't know for sure exactly what that will look like again with the schedule and what those requirements will be for teachers, but we know that we won't be doing that recording of the groups.
Thank you, Jenny. I think we have time for one more question this evening. And any of the supervisors can jump in, whoever would like to. It's regarding hybrid groups and kind of the identification of the A's or the B's. And so the question is, would a parent be able to request a certain schedule, whether they would like their child to come in for the 2A days or the 2B days, in order for that schedule to be similar to another student that's outside of the family group. Or I've also had questions, the same question, but due to parents' work schedules or to outside private therapies, the wonder is, can a parent put a request in for a certain A to be scheduled for A's or B in a hybrid model?
I can
Kelly,
speak
it
to
looks
that.
like you're on. Thank you.
Yeah, I can speak to that, Laura. That actually came up in an administrative meeting this week, and my suggestion would be to follow up with the principal of the building that your student attends and talk with him or her about the unique situation and the context in which you're trying to address this need, and that would be a decision that would happen at the building level with the principal.
Great. Thank you. Well, it is just past 7:30. And so I just wanted to take this opportunity to thank you very much for joining us this evening. I hope that this was helpful and hope that we were able to answer many of your questions and give you some more information. And so after processing through all the information we jammed into 1 hour, please feel free to reach out to myself or to the supervisors with any follow-up questions, and we would be glad to get answers to you as soon as possible. So have a wonderful evening and stay safe, and hope to see you soon. Bye-bye.